This animation file will illustrate the simplicity of the tapered screw vent dental implant system, from implant placement to the SmartSteps immediate impression technique. Patient acceptance of implant dentistry may be hindered by the time that elapses from implant placement to restoration. By allowing the restorative process to begin the day of surgery, the SmartSteps immediate impression technique, demonstrated here, provides a method of reducing the time from implant surgery to an aesthetic outcome. A mesiodistal incision with vertical release is used to expose the alveolar crest. A periostal elevator exposes the implant site. The required surgical tools are sterilized prior to the patient's arrival. A surgical stent was created during the preoperative planning of the case. A round burr is used to mark the desired location of the osteotomy. External irrigation is used throughout the entire procedure. A 2.3 mm pilot drill is used to excavate the site to its full depth. Drilling at speeds of 600 to 850 revolutions per minute is recommended. Use of a parallel pin is an important step after the pilot hole is drilled. It is after the pilot drill is used when variances in angulation can be corrected. Upon verification of the proper angulation, the 2.8 mm intermediate drill is used to increase the diameter of the osteotomy. This graduated drilling sequence is required in all implant cases as a means of limiting the amount of heat generated during drilling, while also providing steps to check the accuracy of the osteotomy during excavation. The larger side of the parallel pin is used after the intermediate drill to verify the relative position of the implant site. The tapered screw vent implant features surgical protocols for both soft and dense bone. The dense bone protocol, featuring a stepped final drill, is shown here. Each tapered screw vent implant comes with a pre-attached fixture mount that also functions as a transfer, which facilitates the recording of a primary impression. The tapered design allows the apical portion to guide the implant into the osteotomy before self-tapping initiates. The tapered screw vent implant features triple lead threads, which allows the implant to seat with 1/3 of the revolutions required to seat an implant with a typical thread pattern. The flat of the fixture mount, which corresponds to the flat of the internal hexagon, is aligned with the facial. The screw channel is blocked out using cotton in preparation for the recording of an impression. Light-bodied impression material is applied with a syringe around the base of the fixture mount to ensure complete and accurate recording of the implant. A full-arch impression with a stock tray is used to finalize the impression-making procedure. A primary impression will allow the restorative clinician to fabricate the temporary restoration while the implant undergoes osseointegration. This service, taking just minutes by the surgical specialist, can save hours of restorative time by allowing the restorative aspect of the case to progress immediately after the implant surgery. In a 2-stage implant procedure, the implant will be covered and allowed to undergo osseointegration for a period of 3 to 6 months. Using the flat of the fixture mount as a rotational guide, the fixture mount and analog are assembled and inserted back into the impression. If desired, a soft tissue material can be used to replicate the gingival tissues. Soft tissue replication using a primary impression is not a crucial step, as the tissues will likely remodel during the healing process, requiring them to be replicated in the final working model. The die stone model is poured by the restorative team, following the manufacturer's suggested guidelines. The relative position of the implant has now been captured, and abutment preparations may commence. The SmartSteps immediate impression technique saves chair time, which increases profitability and makes implant treatment more acceptable to patients and referring dentists alike.